Zika virus is an emerging mosquito-borne virus that was first identified in Uganda in 1947. It was subsequently identified in humans in 1952 in Uganda and the United Republic of Tanzania. The virus has been on the news over the past few months. It has been scaring residents of countries in Central America, Bolivia, Brazil, Colombia, Ecuador, Paraguay, and Venezuela. There are complications of the infection, especially for pregnant women, where virus has been linked to a serious birth defect of the brain, called microcephaly. Also, recently studies in Brazil showed that the number of cases of Guillain-Barré, an autoimmune disease that causes muscle weakness or even paralysis, has been increased since the Zika virus outbreak started. A few days after the mosquito bite, the infected person develops fever, skin rashes, conjunctivitis, muscle, and joint pain. These symptoms are usually mild and last 2 to 7 days.
Welcome back, Dr. Duarte. People in the U.S. are concerned about this new virus that has become the new trend on the news, social media, and internet. Of course, we are talking about the Zika virus. The Patients and Navigation Medical Center has been asking questions, and they would like some insight from you, Dr. Duarte.
Okay, Daisy, it has been an important news over the internet and everywhere in the last year. It's not much of a problem here in the U.S. because we don't see a lot of people bitten by mosquitoes. But we have a lot of patients who travel overseas, and that's why it's a worrisome trend.
All right, doctor, then let me ask you some questions. Has there been any case of Zika virus in the Houston area?
Yes, Daisy, there have been some. There has been 5 confirmed cases so far of Zika virus. We had a patient, one of our doctors has a lot of experience with tropical diseases and suspected it. And we had one confirmed case here in our office from South America.
Dr. Duarte, how can I get the disease besides being bitten by a mosquito?
The main transmission is by mosquitoes, effectively. That's probably more than 99% of cases. There has been descriptions of transmission by intercourse, by sex, because they have found the Zika virus in the sperm.
If I'm presenting the symptoms, how is Zika virus diagnosed?
Well, the Zika virus infection is diagnosed mostly by your history. If you have been out of the country, South America, Brazil, Venezuela, that's the first thing. And also it will be accompanied by muscle aches, rashes, conjunctivitis, which is redness in the eyes, and generalized muscle aches and fever.
If you diagnose a patient with Zika virus, can it be treated?
Well, the treatment is supportive. Your body will take care of the infection. We just want to make sure that the infection doesn't cause too many problems in your system. It's usually just supportive liquids, medications for pain or fever, and just rest.
What is the major risk for my health if I get infected?
Well, the major risk is for pregnant women because has been some association with microcephaly, which is a disease where the children are born with a smaller brain than they should be, a very serious condition. The other issue is there's an increased risk of having a neurological problem called Guillain-Barré syndrome, where you have weakness everywhere.
How can it be prevented?
The main prevention is to avoid being bitten by mosquitoes in an area where Zika is present. So this is a matter of wearing long sleeves, long pants, not shorts, protecting yourself against mosquitoes, using mosquito repellent that's been approved, and that's how you prevent it. That's all you can really do.
Can pregnant and breastfeeding women use insect repellent?
Yes, they can. There is all insect repellents that are EPA approved are safe for women and for breastfeeding, for women that are pregnant and breastfeeding.
One last question. Where can I find more information about this virus?
You can find more information on the comments link below. And if you suspect that you might have the infection, if you come from a place that has Zika infection and you have any of the symptoms, make sure you make an appointment with your primary care doctor, and they should accommodate you to rule out this disease.
Okay. Thank you.
If you like the content of this video and want to see more episodes, please don't forget to click on the like and subscribe buttons below. That way, every new episode will come to you. Also, if you have any comments or questions, please leave it in the comment section below. We will try to answer all of them before the next episode. Thank you and see you next week.